And thank you so much for tuning in to another episode of Stuff That Matters. A special episode today, almost I guess a year in the making of this. We've been trying to get this on the docket, and we're so glad we have Victor Armstrong joining us, the Vice President for Health Equity and Engagement at the American Foundation for Suicide Prevention. Victor, thank you for joining us today.
Thank you for having me. It's a pleasure to be here. And it has been a long time coming.
Well, yeah, Vic, I think you're probably the busiest man in behavioral health. So, yeah, it's an honor to talk with you, get to know you a little bit, and for our audience to kind of get to know not just your story, but also the things that you really care about. Because I know you've got some really strong, you've got some life's work that you are working towards. So, why don't you just introduce yourself to the audience a little bit? Tell us a little bit about your journey, where you are now, but also how you got there to a degree.
Sure. So I am Vice President for Health Equity and Engagement with the American Foundation for Suicide Prevention. So our office is actually based in Manhattan, New York, but I live in Charlotte. And for those who are not familiar with American Foundation for Suicide Prevention, AFSP is the nation's largest suicide prevention organization. We're also the world's largest private funder of suicide prevention research, which means it really gives us access to a lot of information, a lot of resources. So it gives us really a lot of depth in our work around suicide prevention, which I really appreciate. My work there spans across our programs work, our policy work, and our communications work. So the communications piece means I do a lot of the outward facing, public facing stuff. So we get requests for interviews. I do a lot of those. We get corporate requests to come in and do training. I do, some of those things. I also sit on a number of national committees. I serve on the advisory committee for 988, and I serve on the steering committee for the National Action Alliance for Suicide Prevention. So it really gives me access to more of a global view of where things are with suicide prevention, which again I appreciate because so much of my my career, my history has really been North Carolina focused. I was born and raised in North Carolina, in rural northeastern North Carolina, a little town called Plymouth. Population of Plymouth is about 3,300 people, so it's a really small rural town, son of a preacher. So I grew up in a really kind of what I describe as a very small world, very narrow. Everything was kind of black and white. There was no, being the son of a preacher, everybody's either going to heaven or hell, one or the other, no in between. And so so it was a very, very small world. And it wasn't really until I left Plymouth, went away to college, I think that my world started to open up some. And that's, I think, where my journey to where I am now really kind of began because growing up, I didn't know what a social worker was. I never met a social worker growing up. Didn't know any psychiatrist, psychologist, none of that. What I knew was that I did not want to grow up and live in Plymouth and work on a farm. So my way out of Plymouth was going to be banking. So I went to undergrad prepared to be a banker and actually worked for a bank and ran a branch for a little while in Charlotte back in the early 90s. Realized after a couple of years, I hated it. It was not the thing for me. Didn't want to do it. Left that job and actually took a job in Charlotte, Mecklenburg County Department of Social Services, just to give me something to do while I figured out the next bank I want to go to work for. But once I got to DSS, I realized human services was really where my passion was, where my heart was. Being able to do things to help people, oftentimes when they're at their lowest point, really resonated with me. So I ended up moving back to Northeastern North Carolina, went to graduate school at East Carolina University, got my master's degree because I wanted to continue this work in human services and social work. MSW program, I fell in love with psychopathology, was fascinated by that whole genre. And so I decided I wanted to be a clinician. And so I started my career after at post-graduate school as a mental health clinician. So that's kind of where my training is as a clinical social worker. I ran some outpatient clinics back then when when the mental health programs were run by quasi local county government.
Hmm.
Um, I worked for an area program that used to be called Tideland Mental Health, was based in Little Washington, North Carolina. We covered Beaufort, Martin, Terrell, Hyde, and Washington counties. And for a while, I ran three of the clinics. I ran the Washington County Clinic, the Hyde County Clinic, and the Terrell County Clinic. And to give you an idea of how rural this space is, at that time, and it may have changed now, maybe not, but at that time, Hyde County was the only county in the state that did not have a stoplight, didn't have a single stoplight. So very, very rural communities. And in that role, running those three clinics, there was probably a span of somewhere between 6 and 9 months where I was the only clinician in three counties. So
Wow.
I did all of the DWI groups. I did all the mental health. I saw couples. I saw men who were court ordered for domestic violence. I saw the women that they had abused. I saw generations, which really opened my eyes about generational trauma. I would see grandma, mom, and daughter,
Wow.
all of whom had gone through trauma. It was difficult in the sense that when you're doing a little bit of everything, it's hard to really be great at anything. But it was an experience that I will never trade because it
Mm.
really, I think, opened my eyes about community mental health and how we need to focus on community mental health. And, really, how do we create resources that resonate with communities? How do we create resources that are relatable to communities, culturally relevant to communities? And most importantly, how do we create resources that communities are going to be willing to utilize?
Right.
Because I put resources in your community that you're not willing to use, I haven't given you access to the resources you need. I just give myself access to you, which is a whole different thing. And so it gave me a real appreciation, I think, and respect for communities, how communities operate. From there, I worked for that organization for a while, and of course, during that time, we were going through transition, contracting out mental health services and things like that because we were changing at the state level how we were really managing mental health services in the state of North Carolina. So I ended up after working for a couple of different managed care organizations. A lot of what I kind of ended up transitioning into was um, kind of moving away from the day-to-day running of a clinic to more of the building resources in the community. So I stayed with the managed care system for a while, but my role kind of shifted to community operations. One of the things I remember was working with a group, pulling together a group of folks in the community and creating a mental health court in Winston-Salem. We had no money, no resource. Administrative officer of the court said they were not funding mental health courts at that time. But it was just, I mean, that whole process of bringing folks to the table and saying, we don't have the money to do this, but there's a need. How
Mm.
do we get this done? And we were able to do it. And that mental health court is still going strong up in Forsyth County. So that was kind of, where I was really transitioning into really more kind of that macro social work and ended up doing a lot of work with hospitals. So I was because a lot of what I ended up doing with the community, because at that time too, hospitals were kind of shifting in what they were seeing. They were seeing more mental health patients walking their doors and
Yeah.
mental health patients that were getting stuck in their EDs because there were no resources to transition them to. And so I ended up doing a lot of work with hospitals as I was working for a managed care organization, but working with hospitals on how to manage mental health patients that come into their doors, how to get them out. I was working a lot with law enforcement around crisis services. And it just happened one day that I was meeting with a senior vice president for Elements Regional Medical Center. Because by this time I was actually working, I had moved to Burlington, was still working with managed care organizations, but and by this time the area programs had kind of shifted into more of a local management entity role where they were contracting things out. And so I was working actually for Centerpoint Human Services up in Winston
Mm.
by this time. And I was meeting with one of the senior VPs from Alamance Regional, and she just said out of the blue, um, we don't understand any of this mental health stuff. Do you want to just come work for us? And I said, well, do you have a job? Do you have a role? And she said, well, how about if we agree on a salary, can we just write the job description as we go? And I said, yes, we can. And so so I ended up going to work for Alamance Regional, um, and which I loved. It was my first experience working with a hospital in a hospital system. My role really was managing the flow of behavioral health patients from the time that they showed up in our ED throughout their stay in the hospital and then transitioning them back out into the community. But a lot of that meant working with the community to make sure that we had a place to transition them to. So did that for a couple of years. Alamance Regional ended up um, being, they called it a merger. I called it a takeover. They ended up merging with Cone Health.
Mm.
So I worked with Cone for a while and did some work for them at their facility in Greensboro while I was still working in Alamance Regional. And it also happened at that time that Carolina's Medical Center, which is now Atrium Health in Charlotte, had a management contract with Cone Health. And so I ended up doing some things with Carolina's Healthcare, Atrium Health then too. And then one day out of the blue, the folks at Atrium Health said, we're really trying to expand our role in the community and how we interact with the MCO because at that time they had just been assigned a new MCO in Charlotte. This was when Cardinal Innovations was the MCO in Charlotte. And they said, we have a VP role in Charlotte that we think you'd be a good fit for. Do you want to come work for us? And I said, well, I'm not sure how Cone Health would feel about that because, you have a management contract with them. And they said, well, let us worry about that. So long story short, I ended up working for Caroline's Healthcare, which then became Atrium Health. I ran their largest inpatient facility campus here in Charlotte, where we had adult and child inpatient services and 10 outpatient programs on the campus and a 24/7 psychiatric emergency department. So I did that for 6 years, loved it. Um, and then the state called and said, hey, we really would love it if you would consider coming to run the Division of Mental Health. And I said, absolutely not. They
Mm.
said, would you reconsider? We went back and forth. But what ended up happening was I got a call from the governor's chief of staff. And she said, we really think that you should consider this role. See, then she also played we're both from little small towns in Eastern North Carolina card.
Right.
And we both graduated from the same undergrad card. And by the time I got off the phone with her, I was like, okay, I'll do it. So I went, worked for the state for a couple of years, ended up running the Division of Mental Health. And then our then Secretary, Mandy Cohen, decided she wanted to create the Office of Health Equity. And she created a position called the Chief Health Equity Officer for the state of North Carolina. And asked me, would you be interested in serving in this role? I said, absolutely not. And she said, we really think that you'd be good for this. We need somebody who can come and stand this program up. And so end up in that role, did that for a couple of years. Um, Once I had served my time with the state, I left there, did a little bit of consulting and contracts. One of the contracts I had was with American Foundation for Suicide Prevention. Um, and part of it was creating programs, working with them to create programs that resonate with communities. And they came to me and said, well, instead of doing this contract, if we had a position, would you be interested in coming to work for us? I said, absolutely. And so I end up with
Oh,
FSP. I've been with FSP for a couple of years now. And it's one of those jobs where a lot of what I do, I would do for free. So I can't ask for a better job than that.
That's
wow.
awesome.
That is awesome, Vic. It sounds like you haven't had to apply for a job in a while, which has got to be a blessing, man. People are recruiting you out there. I mean,
Yeah,
and
well, you still go through the process, but it's good to know that, that interactions with people, which is one of the things that I often share with young people I talk to, is that, most of the jobs I've had in my career have been based on relationships
Relationships.
and
absolutely.
positive relationships. So you never burn bridges. You always look to do good where you can, and people don't forget that.
Right.
And that has been, and I will tell you, it has been a journey. I didn't talk about these things in my story, but as a social worker, it has taken me to some amazing places. I've spoken in Amsterdam, Ireland, Africa, um, Brussels, just so many different places, all as a social worker and all doing this mental health and suicide prevention work, which, it's just, it has almost been like a dream for me because it just seems like every time I feel like things can't get any cooler, something else happens. I had one of the things that I do, as I mentioned with AFSP, is I work on creating programs along with our programs team that speak to particularly to historically marginalized communities or communities that are disproportionately impacted by suicide. And so one of the programs that I helped to create is a program called Soul Shop for Black churches. And it's a program that um, teaches faith leaders how to talk about suicide to their congregants. 8-hour program. And so I train all the trainers for Soul Shop, and I have been the lead trainer for Soul Shop since its inception back in 2022. Well, in October of 2023, I was doing a training for trainers in Asheville, North Carolina. There was a gentleman who came from Cameroon, Africa, because he's a pastor in Africa, and he actually oversees about 400 pastors in Africa. And he wanted to take soul shop training back to Africa, but he needed to be trained. So he came all the way to Asheville to be trained in him. And so he went through the week-long training. He went back to Cameroon, did a couple of trainings, then decided that he wanted to do more training, but he didn't have any trainers and he can't train them because I'm the only one that trains them. And so AFSP agreed, because this came out of Soul Shop for Black Churches, which is an AFSP program. So AFSP agreed that I would go to Africa and train faith leaders in Africa how to talk about suicide prevention. So I was on the ground in Cameroon for 10 days. We trained 92 faith leaders. 60 of them actually just went through the training to get the kind of some of the core principles about how you talk about suicide. But another 30 of them, 32 of them actually got trained to be trainers, so they can actually go out and do the training themselves. Um, and the whole time I was there, though, and this was back in January of this year when I was in Cameroon, and you can imagine by mid-January of 2025, it was when we're seeing a lot of it's post-election here, and there's a lot of confusion, and everybody's angry with each other, and people are kind of barking back and forth at each other, and you know, it just seemed a little chaotic. So it was a perfect time for me to be able to go to Africa. And so when I get there, I immediately have, just this sense of connection to the people and to the land. Part of it, I think, was because things were feeling so chaotic for me here at the time. But part of it, I think, is because I had never been to Africa, and I had never been in a place where you walk the streets and everybody looks like me. It was just almost like a religious experience for me. It was so cool, and I had a chance to just interact with them. They actually took me to church with them one night. It was just phenomenal. And I kept saying, when I get back to North Carolina, the first thing I'm going to do is I want to find out where I'm from because I want to take my boys back.
Yeah.
Because I want them to see their ancestral land. And so I came back. I did AfricanAncestry.com. Found out exactly where it was. They sent me the results. I got the results back probably about 6 weeks ago. Believe it or not, the results said I was a 100% match for Cameroon, Africa.
You're kidding me.
Wow.
I was standing on my ancestral ground.
That's
And
amazing.
then what makes it even more remarkable, so Francois was the guy that came here for the training, and he was our host when we went back to Africa. Francois, I sent the results to him, so you're not going to believe this. I'm actually from Cameroon. He answered me and said, "You're not going to believe this. You and I are from the same village in Africa. We were both from the Bamileke tribe in Africa. You cannot make this up."
You cannot make that up.
No, it was, and that's why I say, this journey for me has been amazing. This life journey, this career journey for me has been amazing because, it hasn't just been a job. I've been able to just have some experiences that have molded me and shaped me really into who I am now. And I'm just extremely appreciative of the journey and just the career that I've been able to have. So it's been very fulfilling for me.
25 and 12. Simple seemingly ordinary numbers, but these numbers hold a special meaning at New Hope and prompted us to take action. 25, the percentage of young men diagnosed with an autism spectrum disorder, a number that is growing. 12, the average number of months families must wait for specialized residential treatment. But those days are over. Welcome to New Hope's Learning Enriched Autism Program, or as we like to call it, LEAP. New Hope may not change the 25, but we're impacting the 12. We're expanding this program from 6 to 20 beds, investing in the highest quality of treatment models and support systems. LEAP's team of specialists combines the best autism research with trauma-informed care and relational connections to create an environment where our youth thrive. At LEAP, youth learn the skills to reintegrate into their communities and chase their dreams. Families receive the support and resources to ensure this is the last residential treatment they'll ever need. With our enhanced program, the number that holds the most meaning to us now is 40. That's the number of successful LEAP graduates we anticipate annually. That's 40 lives changed. That's 40 families finding new hope through LEAP. That's our name. That's our promise.
That's all. Well, your gratitude for your journey just oozes out of you, which is awesome. I think that's the only way to be. So
Yeah.
Hey, Victor, talk a little bit about all of your experiences. I mean, that's a boatload for a young 35-year-old dude to have all those experiences. No, seriously. Like, I started taking a couple notes, right? Like, you've got some experience around the 988 process. You have experience around crisis intervention training for police officers, Soul Shop. Can you maybe talk a little bit about what you've seen evolve in terms of like CIT training? You've probably seen that grow, seen its impacts, maybe 988. How are we doing with 988? Can you just touch on those things a little bit? And then maybe I have a specific question towards Soul Shop once you get done with that.
Yeah, I think there are a lot of things I think that we should be extremely optimistic about. There are other things I think that, there are going to be some challenges, some things that we have to focus on. I think the things that I'm the most optimistic about, though, is, I can remember not that long ago when nobody wanted to talk about mental health. I can remember going to the legislature and legislators didn't want to talk about mental health. And now there's just much more of an openness and willingness to talk about mental health, especially among young people. And so I'm finding a lot of, really a lot of momentum right now in working with the younger generation, talking about suicide prevention and things like that. So that's really exciting to me. I think the other thing that's really exciting to me right now is I do think we have a different type of appreciation today for creating resources that resonate with the communities that we're trying to reach. It's extremely important that communities see themselves in the work that we do. And a lot of times when communities don't utilize resources, it's because they don't see themselves in those resources. They don't understand them. They don't trust them. And so I think we have a much better appreciation for that now, as we're really leaning more into communities around trying to create resources that are going to resonate with them. I think the thing that probably gives me some concern is I do think that, regardless of our political leanings, I think things are shifting in terms of what we have access to as far as information, as far as resources. A lot of, over the last few months, for example, a lot of the disaggregated data that allows us to really reach into some of the historically marginalized groups or the disproportionately impacted groups. A lot of that data now has been pulled down from sites like the CDC, places like that. So it makes it harder for us really to lean into communities if we don't have the disaggregated data. So that's, I think that's going to be a challenge. Of course, we've seen massive cuts at the federal level. That has impacted a lot of the work that I do because working with the National Strategy for Suicide Prevention and working with 988, those are national programs that lean heavily upon, our partners in the federal space. And so that's had to look different. I think we're finding our footing now and trying to figure out, how do we move forward. But I think one of the challenges there is that a lot of where we end up, I think, shifting and moving our energy is kind of in this mindset where let's focus on the things that we can change, and let's not get caught up in the noise. Let's avoid the noise and just keep moving forward. Even in things like the national strategy, if there are pieces of it that are not going to pass muster, maybe because they get into some of the DEI stuff or whatever, let's not get sidetracked. Let's keep moving forward. The challenge with that for me is that there are people in that noise. And so when we say, let's not pay attention to the noise, I get a little bit concerned because there are some people and some groups today that feel like their identity is being erased. And if we totally ignore the noise, those people don't hear us advocating for them. And so a lot of what I'm in tune with is how do we, regardless what we do, how do we let people know that they're not forgotten? Let people know that, we're still thinking about them. Because when you think about, where we are, and you guys are all leaders, and when you think about where we are today, we need a different type of leader today than we needed even 5 years ago.
Mm-hmm.
Because when you're at a place where people um, don't know the next step to take or what direction to go in, they need leadership, they need direction. But when you are in a place where people are afraid, when people feel disconnected, they need more than direction, they need connection. And that takes a different type of leader. Man, I see the stuff that you post and the things that you all are doing at New Hope. That's building connection. That's building community. Those are the I think that's the type of leadership style that we need today, is one that really builds that sense of connection, that sense of community. Because in the suicide space, the one thing I know that if people reach that point of suicidality, is usually because one of two things have happened. They've either lost hope or they've lost social connection, and sometimes both. And so I think we're in a space today where that connection, that social connection, is so, so important.
Yeah, zoom in a little bit on that. I mean, Vic, and I know you've been a suicide prevention advocate for a long time, so this probably feels like where you are. And I feel like this a lot with New Hope, that you kind of look back and you say all kind of roads led to this in some way.
Yeah.
988. I remember. I mean, that rollout was 2022. Was that the big rollout? Because I remember we did some media spot about it when it first rolled out, and we're physically located in South Carolina, a majority of our work, and comparisons between the states, South Carolina resources were nothing when it came to 988. And so it kind of rolled out like a dud. I think there was a lot of articles that came out right after it rolled out about, is this going to fit? I think that has really turned around, but as an expert, can you speak to where is 988 now? Is that getting traction the way that we want, and what kind of results is it getting, having that resource there?
I think it's a mixed bag. I think for the most part, it has been a success. I think that, I think most of us who have been close to the work would say we've been pleased with how 988 has taken off. I think there are going to be some inherent challenges because you are talking about, 988 really being built on a couple of systems that some communities either don't know or have not had great experiences with. So you're really thinking about some combination of 911, which for a lot of communities, that has a
Not
negative
the number
connotation.
that you want. Right.
And then, there's kind of that mobile crisis piece, because, you think about 988 as being someone to call, someone to come, and then a safe place to take people. And so you think about that mobile crisis piece, and that's sticky because mobile crisis, not every state and not every community is really built to provide that response. And so I think that's one of the areas where we still struggle is it's only going to be as strong as the system that you have to support it. And for a lot of states, there are different places in terms of whether or not they have allocated resources to pay for it. With 911, there's a cell phone tax that automatically pays for 911. Some states have decided to extend that to 988, others have not. And so that's going to be one of the challenges. The other thing I think is that when we even having a conversation at the national level, one thing that I have observed is that when we talk to folks around the country about 988, not everybody's talking about the same thing because it looks different in different states in terms of what resources you have to support it. So in some states, when they talk about 988, they're talking about a designated number to call. We got mental health professionals who show up. We've got crisis receiving centers to take them to. For other states, other communities, that's not necessarily the case. You've got the three-digit number. You may have the capacity to take the call, but you
Right.
don't necessarily have mental health resources to send out to answer the call. So a lot of what I do when I'm talking with different groups, and especially when I'm talking with Black and Brown community, where they may have some concerns about calling 911, what I try to explain to them is whichever resource you're calling, 988, 911, hopefully it's 988, but just try to be sure to ask for a law enforcement officer who's been trained in mental health. Try to give as much information about what the person is going through because you want it to be very clear that what you're observing is a mental health emergency, not a person who is here to intentionally harm someone, and then if possible, stay with that person until law enforcement arrives. So it's things like that that try to get people to feel more comfortable with how you utilize it while we're also familiarizing people with it, socializing people to it as being a trusted entity. Folks still have concerns about, does it track my location, which it does not.
Sure.
They're afraid that law enforcement is going to show up and, over 90% of people that call, there is no secondary resource that shows up. They're able to get what they need, through that phone call. So it's actually working in ways I think that but Polops are probably not aware of, but there still are some challenges. So we continue to work. And I think that one of the final challenges I'll mention is that we still, there's still questions around how it's going to be funded. Will it be fully funded? Will some of the money be pulled back? Will there be um, some type of restrictions on verbiage and things that you can say? There's been a component that speaks specific to the LGBTQ community. There are concerns about whether that language is going to be allowed or not. But those kind of things, in a lot of ways, will make it difficult for some communities to trust 988. Because again, if I feel like you have intentionally excluded me from
Right.
this
Why
service,
am I going to call? Right.
why am I going to call you? Because you just told me you don't want, I'm not your target audience. And so I think those kinds of
Right.
things are challenges. And we've dealt with a little bit of that, from communities anyway, because there were a lot of communities who felt like you're not marketing this to us. Um, and I think the challenge there is that, a lot of the way that we've marketed mental health services, we've had a kind of a mainstream one size fits all approach. And a lot of communities have seen for an organization like AFSP, for a lot of communities, they don't see AFSP as an organization that's there to support them. They see us as an organization that's there to support other people. And that's what we don't want to have with 988. We don't want people to feel like that's for other people. I'm not their
Right.
target audience. And so, so again, that's part of the challenge is how do we get people to see themselves in the resource?
Well, I think your program Soul Shop. I mean, we get a lot of. Let me back that up just even a second. New Hope's like 800 number, right? Just to access New Hope services. We get a lot of phone calls. I get a lot of phone calls from pastors, and a pastor who's got a family in their church, and they just don't know what to do.
Yeah.
And they reach out to the pastor, and the pastor somehow finds us online or is in the local community. And so back to your point about connectedness, right? A community that's connected.
Yep.
If you have a community leader like a pastor who's bought into the mental health services that are offered in the area, that has a voice, I would assume that Soul Shop is shaping some of that, right? In those communities, I would imagine.
Yeah.
Do you get once you train a pastor through Soul Shop? Have you gotten a lot of good feedback? Tell us about the feedback you get from.
Yeah, feedback has been great, and we say the way we describe Soul Shop is that it's for faith leaders. So we're not specific that it has to be a pastor. And I've had people, in Soul Shop trainings some of them are pastors, majority are not. because honestly, it is difficult to get a pastor to sit for 8 hours. It's an 8 hour training. And so we get some, but the majority are not pastors. They're the foot soldiers. They're the people that
Lay
do the
leader,
work in the
yeah,
church.
lay people
But
leaders.
they have
Yep.
leadership roles. They're ushers. They're you know trustees, things like that. But we also get clinicians that come, and in large part, it's because the way I describe Soul Shop, it is a faith-based training, um, and part of the reason I think it resonates with faith leaders is for a couple of different reasons. One is because when you think about resources that, especially suicide prevention resources, there are a lot of secular resources out there, but there are not a lot of resources that speak specifically to the faith-based community. And part of the reason that's important is because a lot of what churches have taught is a very narrow, negative view of anyone who's experiencing suicidal ideation. The only thing they've taught is it's a sin and you go to hell if you die by suicide.
Yeah.
And they don't understand that it's a much broader situation. They don't understand, for example, that you look at one of the things that always shocks them, because part of what I do in the social shop training too is I try to get them to understand there's suicidal desperation even in the Bible, and this is what you're basing your theology on. It always shocks them when I point out that Samson was a murder suicide. They never think everybody knows Judas was a suicide, but Samson, that's a murder suicide. And so it's getting them to think about things like that, but it's also giving them the language to talk about and to be able to identify people that are hurting and giving them the language to be able to talk about it with that person. Because the thing I think that to me is the most special about the Soul Shop training is that sneakily, it is not a religious program. It is a mental health program. And it is about creating access to mental health resources. And so, what I'm actually doing is I am making that faith leader and that house of worship a point of access for someone who needs mental health resources.
Right.
One of the things that we learned, because I was running the division of mental health during the pandemic, and one of the things that we learned was that if you don't have a trusted message and a trusted messenger, communities that don't know you, I don't care how well intended you are, they're not going to engage with you. We first started trying to get vaccines into communities. Communities didn't trust the state, they didn't trust the medical field. They were not going to go out and frequent these vaccine locations. And it wasn't until we decided we need to figure out who needs to be talking to these folks, who needs to be in there delivering these resources, because they don't trust our message and they don't trust the messenger. And so what we're doing with Soul Shop is we're identifying that faith leader as a trusted messenger, and we're giving them a trusted message. We're giving them the language to be able to talk about these things. And coming out of this, I have never had a one person come out of training who said they didn't think it was worth their while.
Nice.
We actually, talking about pastors, because like I said, they're not all pastors, but one of the things that we did do a couple of years ago, probably a little over a year ago now, was we partnered with Blue Cross Blue Shield of North Carolina and Shaw University. And with Shaw Divinity School, we identified 8 pastors with Shaw Divinity School, and we trained those pastors through a grant from Blue Cross Blue Shield to be soul shop trainers. And and so those kind of collaborations, really allow us to broaden the scope of the program. But it also it came about because Blue Cross Blue Shield, they recognized that if we want to reach this community, the church has been a trusted voice
Right.
in Black and Brown communities. And so that's the rationale behind the work that we do with Soul Shop. And it's one of those things. I was just at the American Psychiatric Association conference last week, and I was on a panel talking about Soul Shop. I'm going to be going to Memphis in a couple of weeks, talking about Soul Shop. So there really is an interest in it, and again, I think it's because it not only speaks to the experience that we have, the religious experience that we have as a community, but it is something that when you think about churches, especially for a certain generation, more so probably for the older generation than the younger, but that's been something that's been foundational to our upbringing in the Black community. That there was, growing up in Plymouth, I mentioned um, I had never met a social worker, never met a psychiatrist, never met a psychologist, but we had a church on every corner.
Right.
And so there were a lot of preachers. And so um, that was our go-to. That's where we went to for social connection. That's where you went to for your social services. That's where the church was really the way that we um, alerted or notified the world outside of our community about what was important to us.
Right.
That's why you see politicians, they show up at the churches on Sunday morning. And so it's embedded in the culture of Black and brown communities. And so that's why it's such a great resource to be able to go in and train with them and partner with communities. Because if you come in and you get the blessing of the pastor, then you've got the blessing of the community.
Right. Vic, I'm curious, what did, going back to the personal for a little bit, what did your family, what did your community think about you as you started to get out and venture into this world that may have been unfamiliar to them? And then obviously, and I'm a pastor's kid as well. And sometimes it can be viewed as antithetical to, or a threat to the religion. Like what did that, what was that journey like?
And that also has been a bit of an evolution. For one thing, and I don't know if you experienced this or not, but where did you grow up, man?
I was born outside of Seattle, grew up in the Midwest.
Okay. Well, growing up in rural North Carolina, son of a preacher, I heard my whole life, you're going to be a preacher one day. I see the light on you. I see the anointing on you. You're going to be a preacher one day.
I was a religion undergrad, and it was on that pathway until I took it.
And especially if you don't mind standing up and talking in front of people, then folks assume you've got the gift. You are going to be a pastor. Yep. And I believed it. And so in my 20s, I dabbled in ministry. I was actually a licensed minister for a while because I thought that was what I was supposed to do. Interesting thing happened to me though. I went through a divorce in my 30s, and I had become a relatively popular preacher because it was because a lot of my preaching style was a lot like my training style. It's much more of a teaching style, which was different. Because I came from a long line of screamers, in the church that I grew up in. And so it was different. And so people would call me to come and do different stuff. When I went through my divorce, it all stopped. Because I grew up in the Church of Christ, and the Church of Christ teaches that you have one wife, you can't remarry. And so I was in my 30s. And so they knew, well, he's gonna remarry. He's not gonna be celibate the rest of his life. And they didn't know what to do with me. So nobody called me to come to preach at their churches, things like that. But what happened was I did a lot of self-reflection during that time. And I realized that, there may be a call for ministry, but standing behind a pulpit for me wasn't it. It was something that I did, there was a saying when I was growing up, I hear the older people always say, when it comes to ministry, some were called, some were sent, and some just went. I was somewhere between got sent and just went. I wasn't called to do it. I was called to help people. I was called to bring healing to people. But it wasn't through standing behind a pulpit. And so I recognized that, and I stepped away from ministry. That was something that a lot of people didn't understand, because you don't quit, ministry. You don't retire from ministry. So how you just not? I remember a lady asked me one time, "Who defrocked you?" I'm like, I don't even know what that means.
Sounds intense, though. Whatever that is.
Yeah, sounds intense. But that was and so my transition was really, I just kind of moved away from active ministry. But my father, the pastor, who was the only one that actually invited me to come and preach when I was going through divorce. He and I had a conversation, and that was like, 20 years ago, but he and I had a conversation recently, and he said, you are in your ministry. He said, what you do right now, that is exactly where you're supposed to be. And, when he said that, and not that I hadn't already figured it out, but it was good that he had acknowledged that. But what I've also seen over the years is that I get, and you probably get the same thing, I get so many family members, classmates, people I grew up with that reach out to me and say, "Hey, I'm struggling.
Yeah.
My child is struggling. I don't know what to do, and I feel like I can talk to you because you're in this space." And what they're
Right.
essentially saying is, "We trust you." I had a family member who called me, and this has been pre-pandemic, so it's been at least probably 6 years ago. But he called me one night, and this was a family member who um, had spent 15 years in prison, and he had actually served 15 years of a 31-year sentence. He was sentenced for a violent crime, horrifically violent crime. He kidnapped a man and his daughter and drove them across the state lines, just made it a federal crime and just physically abused them. And so, but he reached out to me, and by this time, he had been out of prison for probably 15 years or so. But called me and said, I'm in a bad place. And he said, "I know you deal with this kind of stuff, but I'm not gonna make it through the night if I don't get some help, because I'm gonna kill myself." And as we talked, what he also shared with me was that he had already attempted suicide 3 times,
Oh,
never told anybody. Hadn't told any of, and I even asked him because this is a close family member, and I said, "Have you?" And asked him, he talked to my dad, who's like the patriarch of the family and pastor. He said, "I didn't talk to him because he wouldn't understand, but
right.
I know that you would understand."
Mm.
And in that conversation, one of the things he shared with me too was that he had learned years ago that he was diagnosed with bipolar disorder, and there was some speculation that even this violent crime that he committed, he was in a manic episode when it happened. He never told anybody that because he would rather have been seen as a violent criminal than someone who had a mental illness. And
Wow.
that's the kind of
Right.
stigma that we're dealing with. But to your question about, my transition, that's been one of the things that really has been, I think, an added bonus for me is knowing that by being this open and talking about this work, it allows other people to come to me and say, "Hey, I need somebody to talk to, and I think you're a trusted person for me to talk to."
To piggyback that a little bit, not to pat myself on the back, but it's interesting parallel. I was away for the weekend with my kids for Memorial Day weekend. We went to the beach with a couple other dads, and my wife texted me and she said one of our neighbors is going off. Like something's happening in the house. I'm about to call the police. And I kind of have a relationship with this individual. He knows what I do for a living. And so as I'm reading the text, I call my wife back and I'm like, I'll reach out to, let me reach out to him. And before I could hang up the phone, that gentleman texted me, the neighbor. He's like, "Man, where you at?" And I just called him immediately. I'm like, "Man, I'm at the beach." He's like, "Oh yeah, I forgot." And so, I was able to talk to him and talk him off a little bit of a ledge.
Yeah,
And it was more of a domestic thing going on, but got him to a place
yeah,
where he's like, "All right, I'm gonna go to bed now," and everything was calm and
yeah,
quiet. And it was, I think, just because he knows the field I'm in, he reached out and was comfortable
yeah,
doing it. And I was
yeah,
happy that he did. I was happy that he was able to reach out to somebody. That's a credit.
yeah. But I would say
Well,
this to Mike. I mean, there are people that I know in the field that I would not reach out to. So
that's what I was going to say.
it's more than just the fact you're in the field. You're in the field, and you're somebody that he respects and feels like he can trust.
I
Yeah,
appreciate it.
absolutely, absolutely. And I think Vic, I've followed you for a long time. I love some of your social media presence too, because again, I think you also do a lot of really powerful intersecting with masculinity, vulnerability, culture. You're somebody that like people would say, "Hey, I kind of want to be." Vic's working at, there's some of these things kind of you said early in the podcast, kind of this black and white dichotomy between you see that a lot in men and mental health, where it's like
Yeah,
you either got to be hard or soft. Like the gentleman that you just spoke of, the fact that he'd rather spend, a third of his life in prison potentially, instead of going through the shame of admitting some level of vulnerability that really is just about brain chemistry. It's not actually about his,
right.
character or his masculinity at all. But those things have just gotten so intertwined. So, I mean, I love seeing a post from you. Looks like you're working out. You just got done, knocking off 3 sets of biceps, but you're talking about something vulnerable and powerful, because these two things can exist at the same time.
Yeah, absolutely. And I think that's, especially for men, I think that's the message. I actually today just finished writing a blog about, and the title is Men Need Self-Care Too. But I think that's a big part of the challenge for men, is that we're socialized to avoid appearing vulnerable. We're socialized not to talk about our challenges. And so when I have conversations with, especially a group of men, it is always interesting to me how open and honest men can be when given the opportunity and they feel like it's a safe space. I think part of, whether we're talking about men's health or whether we're talking about cultural things and people feeling safe based on their cultural, their race and ethnicity, or sexual identity, or sexual orientation, gender identity, what we often do is we label things as a safe space when it's really not. It's a brave space. We want you to come here and be brave and talk about what you deal with. But then I can't tell you it's a safe space when I let you open your soul to me, then I turn around and walk away, and you're left to deal with the aftermath or the ramifications of someone saying, well, you said this in that conversation, so I'm going to have to keep an eye on you now so I think that's part of the challenge, is that we need more truly safe spaces for men to be able to talk about the things that they're going through. A lot of these groups, men, oftentimes it's the first time they have collectively had a conversation about suicide, because we don't talk about it. When I have conversations with the Black community, or I'm doing a lot now with the AAPI community or with the Hispanic community, when I get groups of them together, oftentimes it's the first time that they've had this conversation openly, because culturally it just has not been something that they've been open to talking about.
And with the stats on male suicide attempts, sometimes their first attempt is going to be their last attempt, because it's going to be successful more often than not. So it's even more
lethal.
More imperative. So
yeah, but one of the things that we're finding now, though, some of the more recent data shows that more and more younger people and girls are dying more often by firearm now than they have in the past. And so it's it's a scary situation. One of the things I was sharing this with the group recently, like when we look at when you break it down and look at where the suicides come from, like we know 70% of suicides are white males. We also know that older Black females have among the lowest rates of suicide. We don't fully understand why that is. There are a lot of theories. We don't understand why. But what is concerning to me is that when I look at how we're trending, one of the fastest rising demographics for suicide is young Black people, Black males in particular. But the suicide rate for young females is also rapidly increasing. And so I don't know if 20 years from now, 30 years from now, we'll be saying that that demographic of older Black women are, not dying by suicide, because we have a generation coming behind them where it is happening. And so those kind of things are things that I think are things that we really need to be mindful of, because we have to get upstream if we want to really deal with suicide.
At New Hope, we believe that culture is everything. Residential services is what we do, but culture defines who we are. Sadly, poor culture issues are at the heart of unfortunate incidents involving staff and kids in residential programs all across the country. These incidents have led some to question whether residential services should even have a role in our mental health system of care. This is why, at New Hope, we are called to be different. We are called to stand out from the crowd. Our kids' experiences will be a direct reflection of our culture. So, let's name it and let's build it.
We are committed to a culture of positive relationships that are built on trust and care for our kids, each other, and the community.
We're committed to a culture of teamwork, We always ask, how can I help? And we never say, that's not my job.
We are a culture of fun and laughter. We take our work seriously, but not ourselves too seriously.
We are committed to a culture of shared excellence. Leaders are always coaching, so team members are always growing.
That's the New Hope culture. Our goal is to be the best provider in the country, and our culture demands that everyone is passionately rowing in the same direction, at the same speed. We call these commitments because the culture is continuously created and maintained by our actions every day. It's not static. It's a living, breathing thing. It's built in every conversation, every email, every conflict, every interaction. You, watching this video, are either actively building this culture or actively working against it.
I'm committed.
I'm committed. I'm committed to building the culture.
Attention New Hope staff and all communities, we have a successful discharge in the lobby. Please put your hands together and show your love for Joshua.
I'm committed to building a culture at New Hope that everyone wants to be a part of. My question is, are you in?
Victor, another, I guess, a newer presence for you online is your podcast, Strong Talk. You mentioned the story earlier about the pastor in Cameroon that was actually released on an episode back in February. The podcast in general, it's interesting. It has the same trajectory as our podcast, Stuff That Matters, because you started back in, I believe, 2023, as did we, the summer of 2023. Why that started? Obviously, I'm assuming it's just another avenue for you to share your experiences, potentially create a safe space for people to talk about some of these topics. So the podcast in general, just speak on, why it started and what it means to you.
Well, for one reason I guess I do is because nobody listens to me at home, so I need to have a podcast. But it started. It was something I had wanted to do for a while. And when it first started, it really was the genesis of it really was when we were really leaning more heavily into equity. And there was more conversation about equity and how do we infuse equity into our systems. And, we were having conversations about 988 at that time. How do we make sure that it's resonating with communities? And so a lot was about equity, about access, but also what I had hoped initially too was to help people broaden their perspective about what equity means and about what access means. That equity is not about race and ethnicity. Equity really is about making sure everyone has the best opportunity to be their healthiest self. And so it pertains to, how do we make sure we're reaching the rural communities? How do we make sure that our veterans are served? How do we get to our, the aging population? And so it really was about broadening that conversation. And at that time, I had a conversation with a guy named David Covington, who is CEO of RI International, Recovery Innovations. And he and I had a conversation. They do a weekly, what they call a crisis jam, where they, every Wednesday at noon Eastern time, they have 300 to 400 people online from SAMHSA, all different communities. But it's really about crisis services. And a lot of the work around 988, a lot of that wordsmithing and a lot of that brain work happened in that crisis jam. And so he and I had a conversation about because I at times would add a little snippet on the crisis jam about equity and access. And I just finally said to David one day, I would really love to do a podcast about health equity. And my initially I wanted to call it Equity Matters. Then I realized everybody had a podcast called Equity Matters. And but the more we talked, I said, maybe I want to call it Strong Talk. It'd be play on my name. And so we decided to call it Strong Talk, but it was going to be a platform to really talk about equity and access. And so RI International, they supported the podcast for a while. When I came on board with AFSP has since taken it over to support it. And it's it still kind of has the same equity flavor. I don't lean quite as hard into the equity space as I did initially. Now it really more is about people's stories. How did you get to where
Mm.
you are? What's your story, and how does your story encourage somebody else? I talk to people that I'm curious about. I talk to people that I'm interested in talking to. So I have loved doing it.
I got one more before we wrap officially. Taking people behind the curtain a little bit. This is actually we're recording. This is actually a rescheduled date from a couple weeks prior. And you kindly, when you informed us that you had to reschedule, we were actually at a charity golf event hosted by the American Foundation for Suicide Prevention. So you talked about a little bit earlier the impacts on building relationships, connections, that sense of community, as it pertains to community events like charity golf events or whatever the case is. Charity events, how impactful are those on the research, raising awareness, potentially providing more resources for people in need?
Yeah, I think they're impactful on a number of different fronts. I mean, number one, we can't do this work without money. And so, when you're doing these events that raise money, raise resources, I know people, sometimes will raise their eyebrows when you're trying to raise money, but I mean, the reality is
Right.
you cannot do this without money. And
Right.
so, and everybody loves golf. And so, even though I don't play, but everybody else loves golf. So, and so things like that are impactful. But the other thing I think is it raises awareness about what we're doing and why we're doing it. And it does it really in proximity oftentimes to high profile people because you'll have either local business people or athletes or, figures that are known in the community that will participate in these events. And when it's juxtaposed next to suicide prevention or mental health awareness, things like that, it does elevate awareness around those kinds of issues. And so I think it's extremely important we continue to do those things. We're seeing now more and more where musicians and athletes are willing to talk about this. And so it also gives us an opportunity when we have these kinds of events. It really broadens the pool of people that we can tap to come and participate in these kinds of things. But I think these things are extremely important. We do, fundraisers with the music industry, the sports industry. We do our walks. All across the country. We have 73 chapters across the country, chapters in every state, including plus Puerto Rico and DC. But we do walks, all across the country, and those walks, they're fundraisers. And the reality is, research costs money. We do a lot of research grants, and we're able to offer research grants because we're able to raise the funds to do that. And so it's extremely, extremely important. And I encourage people when you see opportunities, even if you are not a person that wants to participate in the event, if you see opportunities and if you're able to support them, by all means, support these opportunities because there are people that depend on these kinds of
Mm.
resources to be able to minister to their needs.
Uh, Wrapping up here, I know we brought this to your attention at the beginning. Final question for you, your chance to encapsulate your overall message, which you've certainly been doing throughout this episode, but I'm going to ask you anyway. Victor Armstrong, what is the stuff that matters?
At the end of the day, the stuff that matters most to me is human connection. I think it all comes down to how do we, as human beings, how do we interact with one another? How do we support one another? I think that more and more I'm seeing where we seem to all be going into our separate corners and people are becoming
Mhm.
more and more, we're becoming a much more divisive
Right.
society, and it feels like people are choosing sides. And as long as my side wins, I don't care what happens to the other side. And I think that's dangerous because we have to have respect for humanity. We have to understand that if, just by virtue of your humanity, we have a human connection. And as I shared before, when people reach that point of suicidal desperation, it's usually because they've lost hope or they've lost social connection. And so, what I try to make sure people understand on a daily basis is that you matter. If you are a human being, you matter. Your life matters. Your pain matters, and you are not alone. What I
Mm.
share with faith leaders all the time is, as faith leaders in the church, we've been very good at telling people what to do. But are we willing to sit down with a person who's experiencing suicidal thoughts and say, you matter, your life matters, your pain matters, not only to God, but also to me?
Right.
And I think to me,
Mm.
that's what this is all about.
Fantastic,
Well,
Victor.
Yeah. Thank you, Vic, for your time. And I'll put this out into the ether. I think I would vote for Governor Armstrong. I'll just throw that into the world. I don't know
I'd
if
go
that's
with President Armstrong.
I'll do anything, man.
Can I tell you just a real quick story?
Of course.
Please.
So you see behind me back there, you see the picture that's got a bunch of people in it. So that was a picture I took in Cameroon, Africa. Those were our team in Cameroon that was on the ground as training people. And so, when I was there, and as I mentioned, I had this connection to people. It was funny because everywhere I went, people told me, you look like my brother, you look like my uncle. I think you must be from this place, that place. And so I had this big group picture that I took, and I brought it home and framed it. And after I got my results back saying that I was from Cameroon, I decided to take my picture down, and I'm, looking at the picture, and I realized I am not in this picture. And then I said, you know what? All the people who said I look like them, they were right. I look so much like them, I didn't even realize I'm not in this picture. And so I ended up switching it out for the other one up here. But that was how I think how connected I was to that group. I looked at a picture of them and saw myself in it. And I was
I think I'm in the back. I think I'm in the back somewhere.
Yeah. But thank you guys. This has been great.
Vic,
thank you so much.
In a couple weeks, will you be in Raleigh?
No, I've got to be in Memphis. There's a mental health faith-based conference in Memphis that they've been doing. It's like the 11th year. It's kind of a big deal. And so they reached out and asked if I'd come down. And so I'm going to go do that on the 10th and the 11th.
And then we can talk offline a little bit. But if there's stuff that you feel like we could be a good partner with, corporate partner, we threw some money at that golf tournament that ultimately benefits AFSP.
We do a lot with NAMI.
NAMI.
Let's talk about that because I am trying to build partnerships, and we're also thinking about the fact that there are a lot of organizations that have expertise in this space, but suicide is not their specialty. And so that's our specialty. And so I am looking at opportunities to partner and maybe bring our expertise alongside other folks' expertise, and looking at which, by the way, I'll send you some information. We're actually having a health equity summit that's going to be taking place in Atlanta in September. So I'll send you the information on that as well. But yeah, I would definitely, I would love to think about ways we could partner, collaborate.
Yeah. Think of us always.
Yeah. Even when the walks, for example, we've been the presenting sponsor for NAMI's walks each of the last 2 years.
We got about 115 people out there, I think, last fall at one of their walks. So we can galvanize some people.
We haven't reached out to the AFSP?
The AFSP golf tournament was called the 7-Eleven Memorial Golf Tournament to benefit AFSP. The invitation came from the woman who organized the tournament in memory of her son,
Sherry
whose birthday was July 11th. Her name was Sherry Nim, from the Rock Hill TKK area. So she was just a mom organizing this golf tournament, who all the proceeds went to your organization. That was the first solicitation we ever got that had your organization tied to it.
Okay. Well, that'll change.
Yep.
That's good. Well, Vic, again, thanks for your time, and I love what your dad told you, and I love that you were able to hear that from your dad. That hey, you're doing what I think you're meant to do on this earth. I think we all want to feel that, and we don't always get to hear it. And I think it radiates from you when you tell your story and talk about your work.
Thank you. Hey, I appreciate what you guys do. You are doing phenomenal work down in New Hope. So thank you for all that you do.
Thanks, man. Appreciate you, Vic. We'll talk soon.
All right.
Take care.
Take care.